Now, let's go to the latest on the epidemiology of this pandemic and what's unfolding in Victoria and around the world. We're joined again by Professor Peter Collignon, infectious diseases expert. Thanks for joining us, Peter. Good to talk to you. I'm fascinated on your take about where Victoria is heading because those infection numbers are encouraging. A couple of days in a row below 200. We're told they're expecting to go into single digits soon. But, of course, the death rates, almost overwhelmingly in aged care settings, still very high, another 23 deaths in the past 24 hours.
Yeah, look, I think the Victorian epidemic curve is definitely moving the right way. You've got to really look at 5 or 7 day moving averages because it can go up and down too much, from day to day. But it's probably been going down for at least 10 days, if not 2 weeks, which implies that it may have been the level 3 restrictions that had most of the effect rather than necessarily the most recent one. But I guess we can try and dissect that out later. But deaths always also occur about 2 weeks and even later after your cases because people get sick, they're looked after, and unfortunately a number of those people don't survive. And the other really important issue is how old the people are who get infected and their underlying medical conditions. And that's why nursing home people have such a high death rate, well over 20%, because not only are they older, usually over the age of 80, but they're often got underlying heart, lung conditions and other health problems that makes them even more susceptible to having a bad outcome. And there's still a lot of infections that have occurred in nursing homes. My understanding is now those numbers are decreasing, but that's going to take a while to come through. So I think we'll keep on seeing decreasing numbers and continually, a drop in this epidemic curve. But unfortunately, the high numbers of deaths per day may continue, at the level of 20 or so for another week to 10 days before they start coming down as well.
The classifications is an interesting debate too because the Chief Medical Officer in Victoria, Brett Sutton, the other day said that even people who are in palliative care and get the coronavirus are counted as coronavirus victims. So it's that comorbidities issue that we've talked about before. But I do wince, Peter, when you say things like it might have been the stage 3 restrictions that have accounted for most of the pushing down of the infection curve here, because you think about the disruption, the social disruption, the communal disruption, the economic disruption that have been brought about by stage 4 and the curfew.
Well, I think we do have to try and dissect out what are the different things we've done that make the most difference. I mean, we had the epidemic in March and April and it turned around, and it probably turned around before all the more major restrictions were put in place. Now, it's not that restrictions won't aid it. You'll get more benefit if you really have everybody stay at home and not move around in curfews. But how much extra benefit, at what cost, I think we're going to have to start working that out. Because if you look at last March and April, the two places that had the hardest lockdown, New Zealand and actually Victoria, haven't necessarily had the best results over the medium term. I mean, Adelaide had by far the less restrictive movements on people, even though they had quite a number of cases. Yet, have had among the best results. And even the ACT, for that matter, didn't have the same restrictions as did Victoria and even New South Wales, but has managed to keep, transmission down at really low levels, or in fact hasn't had any. So I think we need to try and dissect it out. It's really hard because there's so many confounders, and New South Wales, for instance, had the most cases. Even this definition of where we restrict travellers from, we need to actually probably start having objective data. I mean, I don't think anybody would say it was a really good idea if people from Victoria, particularly Melbourne, were travelling around the country. There probably was 1 in 1,000 people that might have been infected at any one time that were wandering around and not, under quarantine. In New South Wales, it was probably 1 in 100,000. Now, that's different levels of risk for letting people move and hotspots, and I think we've got to get better at defining that because we're going to have this problem for another year or two or more, and we've got to probably have more objective data as to when we put restrictions on people, how long we keep it from movement, and even how many people you let visit your house, etc.
Spot on.
It's quite appropriate to call a crowd 1 or 2 when there's a lot of community transmission, but that's quite different if you're in New South Wales and maybe there's only 1 in 100,000 people or less who might have infection there in the community.
Spot on. We've got to get better at this stuff, and very quickly, as you say. I just want to show you some graphs that show mortality rates in various countries because I want to get your interpretation on this. Let's look at Sweden, which has been focused on by a lot of people because they didn't have a severe lockdown. They had social distancing. You lost a lot of people early on, but they've really flattened. This is not in the infection curve. This is their mortality curve, the number of daily deaths. If you go to the US, which of course we focus on a lot because they've had the most numbers in overall terms, and obviously a huge spike early on, flattened a bit, but climbing again now. And compare that to Australia, where we had deaths early on. We're then proceeding very, very well before the outbreaks in Victoria, especially in aged care homes. I think the key point on this, Peter, is I want to get your interpretation of Sweden, much criticised for its approach early. Could they have been onto something there?
Well, I still don't think the Swedish approach was the right approach. I mean, I wrote an opinion piece a few months ago saying I didn't think the New Zealand approach of being such a hard lockdown was the way to go, nor the Swedish approach, because at that stage, Sweden had something like 50 times a higher death rate than Australia per head of population. And it's still much higher, despite having that flattening. Now, I guess we'll be wiser a year or two into the event, but, you know, there's no doubt that this is not a good infection to have spreading around. And I think there's no doubt that Australia has done better than Sweden with less deaths per head. And if we had better controls of what happened in nursing homes, it would have even been less. But, you know, this is a long term. We're going to have to work this out. We can't be all hermits for the next 2 years, but equally, I don't think we can just say, let it rip either.
No, exactly. So mortality rate over a couple of years, that's really going to prove the methods, isn't it?
Well, it is. If you look at 2017, which was a bad year for influenza in Australia, I think 1,250 people died in an ABS analysis was done. Most of those people were well and truly over the age of 90, in fact. So we do actually know what happens in a bad flu season. This virus is 10 or 20 times more deadly than influenza. And we have managed to keep much better control of it, and I might say influenza, because there's very little influenza circulating either. So we're going to have to do something better than we were doing in 2019 and 2017. But we can't all stay locked up at home forever either. So we're going to have to find some middle ground. And I think Australia has done that better than both Sweden and I think New Zealand for economic and social being. If it wasn't for Victoria, and this could happen anywhere in Victoria, but Australia has actually been pretty good, even with the cases in New South Wales. If you take Victoria out of our epidemic curves, we had a little blip this winter so far, although we need to wait till the end of September. But Australia has done very well from a per capita perspective, or any way you want to look at it.
Absolutely. Thanks for joining us, Peter. Appreciate it again.
Thank you.
Professor Peter Collignon there. There you go, in Victoria, where people are saying, yes, keep locking us down. Yes, keep the curfew on. Yes, keep the compulsory masks. Masks, I think, were part of stage 3. But as Peter was saying, stage 3, perhaps all this was working pretty well before the curfew and stage 4.